Whether you're a clerk or a waiter, an accountant or a doctor, your health matters.
Hello, welcome to Your Health Matters. I'm Dr. Tasila Tembo Peters, and on today's program, we look at pneumonia in children. Our expert of the day is Dr. Chishala Chabala, a pediatrician from the University Teaching Hospital. He explains more about pneumonia in children. To start the program, we got views from the public on what they know about pneumonia in children. And here is what they had to say.
Pneumonia, what I know about it is that it's a disease that comes due to cold, though I don't know much. Yes.
Pneumonia ninga na meboza palibe chabenizi wa chili chonse but nimwera chabe kuli pneumonia sources palibe menenizi.
Tulaso tumabwera ku bana futi ngati mwana futi akali mng'ono venangu timatenga bana noyamba basebenzesa ntchito zali za size yawo zenika mwana kakalibe okosa mchifuba kama onongeka mchifuba
akamaka kumwana manje mpepo ikamungena ndiye vidavauti ukaenda kliniki bazampeza pneumonia mambo mpasa manje ma injection
tulaso tubwera na mpepo bijangati mpepo ya mungena mwana pesa ashitwana kalaso
pneumonia is when you don't put plasmodium but now we're malaria.
So pneumonia is basically an infection of the chest, and specifically in the chest it causes infection of the lungs. In the common terminologies, people refer to pneumonia as in Bemba they call it tulaso, in Nyanja tulaso, and it's basically because your lungs have been infected by either a bacteria or a virus or some fungi. In small children, it can actually be caused by TB infection as well. So the most serious types of pneumonia are caused by bacterial infections, and these usually make the child very sick. If it's not attended to quickly, this often results in death. Sometimes children may catch a flu, and after some time that flu progresses and can result in pneumonia. Usually that type of pneumonia is caused by viral infections, and often they don't make the child very ill, and they usually resolve very well without any complications. And then also there are other types of pneumonia which may affect patients whose immunity is low, like for example if you have HIV infection you can have fungal pneumonias which are usually very debilitating and can make the patient very, very sick. Pneumonia is very common in children who are younger, so children who are below the age of 5 years are very highly susceptible, or they are very prone to having pneumonia. And it's one of the commonest causes of childhood illnesses in Zambia today. The commonest symptoms of pneumonia is cough, fever, and difficulties in breathing. The child who have this cough which is not going away, the child will feel hot, and when they look at the child looks like it's breathing very fast. You know, if the child is hot and has a lot of clothes, they can remove some excess clothes and expose the child so that the body temperature can come down. They can get a wet cloth and just dab the child on the body, and if they have a bit of Panadol at home, they can give the child some Panadol, and then immediately, this is a child who shouldn't be kept home, should be immediately taken to the health facility to be attended to by a healthcare provider. Although we know that it can resolve even without treatment, but when a child has pneumonia, it's a serious illness, it can result in death, it can result in hospital admission, so the child needs to be attended to as quickly as possible and given the right medicine. The healthcare provider or a doctor will assess the child. The child will have a very high fever, and when you examine the chest, you'll find that the child is breathing very, very fast. And when we use our instruments to listen to the chest, we can tell from the sounds that are coming in the chest that this is a sound of pneumonia. And then also we do other tests. We do chest x-rays. When we do an x-ray, we can actually recognize pneumonia from the x-ray. And then also in some instances we can take samples from the child that will help us establish a diagnosis of pneumonia. The main problem in pneumonia is the child will have difficulties in breathing, and therefore from just that assessment the doctor will determine whether this child will need to be supported by oxygen, because one of the problems is that the chest is not getting enough oxygen in the lungs because of the infection. So sometimes the child may be placed on oxygen if it's very sick. If the child has a very high fever, the doctor will give some medicine to drop the fever, and immediately the child then will be put on antibiotics. Depending on how bad it is, the doctor may decide to put drugs through by the intravenous line, which they are given injections, or if it's a very mild pneumonia, they can be given oral antibiotics. And then other measures, obviously the child, if the child is in pain, the child needs to be given painkillers, and of course it's always important that the child who's sick should be fed. If the child is having poor feeding, we take measures to feed the child. Pneumonia is a treatable disease, and the most important thing is that the mother or the caregiver needs to seek attention as soon as the child falls ill. And once the child is brought to the health facility and recognized to have pneumonia, the treatment is available. It's a curable illness, and most of the time a child heals very well without any complications. It's important that parents avoid treating their children at home, that when the child is sick and is coughing, they then go to the canteen and buy medicine. As much as possible, parents should avoid that. When the child is unwell, the parent should take the child to a healthcare provider who is going to prescribe the right medicine. So the parent shouldn't take it upon themselves to start administering treatment at home. One of the ways in small children that we prevent pneumonia is through vaccinations. So we make sure that any child who's under the age of 5, they received all the vaccinations. Some of the vaccinations that we give in our national immunization program prevent specific types of pneumonias. So that's one way. The other way is that the child needs to have just an adequate nutrition. Children who are not properly fed and are malnourished are very prone to pneumonia. The other things are measures in the home. Having proper ventilation in the house, ensuring that our windows are open and all that does help in ensuring that you reduce the risk of catching pneumonia. When the weather is cold, sometimes our bodies become susceptible to pneumonia when it's cold. So just ensuring that a child is adequately kept given warmth when it's very cold.
Indeed, pneumonia in children is one of the most common causes of admission in our health facilities countrywide. This disease can be prevented by ensuring that children under the age of 5 have their vaccination done. It is also important to note that when you have a child having symptoms suggestive of pneumonia, these children should immediately be taken to the nearest health facilities so that they can be attended to. Early diagnosis and treatment is very important in treating pneumonia. We've now come to the end of today's program. Do visit our website for this particular program or others on www.moh.gov.zm. This is Dr. Tarsila Tembo Peters. From me, stay healthy.
It matters, your health matters, yes, it matters, oh. Whether you're a student or a mother, a